Hi all, this is Dr. Rajni Dable and today I am here to talk about a very commonly faced problem by most of us, and that is bad breath. So what is this bad breath and how to get rid of it, we will see in today's video.
Do you know bad breath is something that can spoil your personality, your impression in public, and it can even break your relationships? Yes, it is something which looks like a small problem but can bring you a big embarrassment when you are in public and with your near ones. So today I am going to explain you everything here step by step. First of all, let us understand that mouth is not a garbage house. We eat whole day something or other without thinking much. We just put things in our mouth, but we do not clean our mouth every time after eating. Remember, whatever you are eating is hiding into the spaces and crevices of your teeth, which facilitates the bacterial growth. Actually, our immune system controls the bacterial colonization of the mouth and prevents the local infections, but the high concentrations of bacterial metabolites result in dental diseases that lead to bad breath. What is bad breath? It is an unpleasant or offensive odor coming from the breath, regardless of whether the odor originates from oral or non oral sources. Now, before I go further, let me tell you that I will be using a term called halitosis henceforth because it is a scientific terminology used for bad breath. So, halitosis mainly is classified as extraoral and intraoral. Extraoral halitosis is mostly found in ear, nose, and throat area, or in rare cases, it is also found in gastrointestinal tract. Here we will talk mainly about intraoral halitosis, though I will tell you the difference between two. Intraoral halitosis is further divided into real halitosis and temporary or transient halitosis. Let us see what is real halitosis. It is an obvious malodor with intensity beyond socially acceptable level affecting personal relations, and mainly the source lies within the mouth. The origin is often a coating on the dorsoposterior surface of tongue, that is the top portion of your tongue, and also some pathologic conditions of oral tissues. Temporary or transient halitosis, it is a malodor caused by certain foods and dietary factors such as garlic, onions, etc. Or morning bad breath that we all experience after waking up in morning. Now here for your knowledge, I would like you to understand what extraoral halitosis is and how it is differentiated from intraoral halitosis. Extraoral halitosis is of two types, blood-borne and non-blood-borne. In blood-borne halitosis, the malodor originates from disorders anywhere in body. For example, hepatic cirrhosis. Hepatic cirrhosis is a condition in which the liver does not function properly due to some infections where the liver cells die, and due to that there is a typical foul smell that is coming through the mouth. Non-blood-borne halitosis is the malodor that originates from nasal, paranasal or laryngeal regions due to upper respiratory tract infections, viral infections such as cough and cold, or due to some digestive tract infections. Sometimes even a simple indigestion also can give rise to halitosis. There are some other types of halitosis such as psychogenic halitosis, where the obvious malodor is not perceived by others but the patients complain of its existence. Pseudohalitosis, here again the patients feel that they have some kind of halitosis. Halitophobia, where the patients persistently believe that they suffer from halitosis even after the treatment. Now, as you know what the halitosis is, we will see the main reasons and conditions that are responsible for it. You all know that anything that stings is either spoiled or badly decayed. And this happens mainly due to the presence of bacteria. So we will learn here about the bacteria and the bacterial infections that are responsible for halitosis. Mainly there are two types of bacteria causing the infection. Aerobic bacteria or aerobe that can survive and grow in presence of oxygen, while the other type is anaerobic bacteria or anaerobe that does not require oxygen for growth. And mostly when there is infection, there is suppuration. Suppuration means pus formation, and whenever there is pus, there is no oxygen. So you can understand here that oral infections are mainly because of these anaerobic bacteria. Now, these anaerobic bacteria are either gram positive or gram negative. I will tell you the difference between two. There is a procedure called gram staining that stains the bacterial cells either purple or red, thus distinguishes them. Gram positive bacteria retains the crystal violet color and stains purple, whereas the gram negative bacteria lose crystal violet and stain red. Now, the reason behind telling you all this is gram negative bacteria are more resistant against antibodies because their cell wall is impenetrable, and that is the reason why sometimes the antibiotics work with lots of difficulty in some infections. So now you will understand that anaerobic gram-negative bacteria is the worst combination that is involved in oral infections. Now let us see how exactly these anaerobic bacteria work. Anaerobic gram-negative bacteria degrade organic substances, for example, saliva, food debris, tissue cells, etc., primarily into volatile sulfur compounds. These volatile sulfur compounds are nothing but the excretions of bacteria that they drop inside the mouth, and they produce a foul smell. These volatile sulfur compounds producing bacteria are commonly found at the bottom of the microfurrows and crypts on the dorsoposterior surface of the tongue. These bacteria are mainly associated with gingivitis and periodontitis. I will talk about these two topics separately in my next videos. Here I will give you little idea about these two conditions related to halitosis. Now let us see what causes the real halitosis. There are many causes, but the most important is presence of plaque and tartar. Plaque is a colorless, sticky layer consisting of mucus and other particles that accumulate on the tooth surface and gums. Brushing and flossing removes it. But when these layers harden, it forms tartar that does not go by brushing. Only a professional cleaning by a dentist or dental hygienist can remove it. Gingivitis. If the plaque and tartar remain for longer time on teeth, they become more harmful. They cause inflammation of gums, and that is called gingivitis. In gingivitis, the gums become red, swollen, and can bleed easily. Periodontitis. When gingivitis is not treated in time, it can advance to periodontitis. Gums separate from the teeth and form spaces. These spaces are called pockets. Bacteria accumulate inside these pockets and eat up the gums and the bone, thus loosening the teeth that may eventually need extraction. Another most common dental disease is dental caries, that is dental decay. Here the bacterial acids attack the tooth surface, that is enamel. This can lead to a small hole on a tooth called cavity. Food gets lodged in these cavities, and if it is left there for a long time, it gives rise to halitosis. If tooth decay is not treated, it can cause pain, infection, and even tooth loss. In addition to these factors, there are some cofactors that significantly influence halitosis, such as stress, smoking, mouth breathing, unbalanced diet, low water intake, which causes reduced salivary flow, and excessive coffee and alcohol consumption. Intraoral halitosis can be treated effectively by cleaning the tongue with a tongue scraper and by using chlorhexidine containing antibacterial mouth rinses. That way the anaerobic bacteria accumulation can be restricted. Common anti-halitosis products in market, you will get plenty of them. The most commonly used anti-halitosis products are chewing gum, candies, etc. However, it is known that these products only have masking effect. Halitosis returns immediately after you stop using them. The best treatment on halitosis is removing the root cause of it, and for that one has to visit the dentist immediately when it is first detected. Do not wait until it worsens, as there can be a bigger reason for having it. There are easy treatments for the dental problems that your dentist will explain to you. Few more things to keep in mind: drink a lot of water, correct your digestion if you have problems with it, brush your teeth twice daily, and visit your dentist every after 3 to 6 months for a dental checkup that can keep you away from the dental problems and can save your money and your time. So say stop to halitosis